1 in 4 nurses suffers from PTSD, and I'm one of them. Hi, my name is John. I've been a critical care nurse for many, many years and have been traveling for like the last 5. And mental health is a very important topic in healthcare today. Some of the things that I deal with come from, of course, the COVID and the time that I worked during that period, but also my time as a flight nurse. Whenever I hear a phone go off, and it's a very particular like beep, it's the, I'm gonna date myself a little bit, but it's the old Nextel phones, and they would go bloop bloop, but they would beep in a very particular way. And we carried those around as flight nurses, and whenever we had a call, that's how they would contact us, is we'd hear the bloop bloop, and then they would say that, hey, you've got to go, here's what it is, that kind of stuff, and you would have to get ready to, get onto the helicopter, get your things, whatever you needed, and get going. And to this day, whenever I hear one of those, unfortunately they're not as much, I get this rush of adrenaline. And even talking about it right now, it's happening a little bit. Goosebumps and stuff, and it's just from a body response to that kind of flush of adrenaline that I would get whenever that would go. And for the longest time, I didn't really know what it was, but after reading more about it, it actually is a symptom of post-traumatic stress disorder, or PTSD. With the statistic of 1 in 4 nurses suffering for it, they think actually it might be quite a bit higher, and COVID was certainly no exception. But just generally, the type of job that we do in dealing with patients and family nurses. I had a day that I got off work the other day was really tough, where we just had, we were short and the charge was in account, and even the manager came in to take patients, and we had difficult family members because those family members are losing control of their loved ones. They don't have control over the situation, and they just don't know how to deal with it. So oftentimes they take it out on you as the nurse, because you're the most direct line of interaction between the healthcare system and the patient and the family member. That day we ended up transitioning 3 different people to comfort care, and they passed away. It was a difficult time. I got into the car, I had to call my wife at one point in time and just say, hey, I just needed to hear your voice. So I just want to kind of bring this awareness out and say that we need to talk more about it as a community, as a group of nurses and healthcare, and certainly travelers, because as a travel nurse, you're unique in the fact that we're dealing with all of the typical nursing stuff that we all have had to deal with. In addition to the stress of being able to have to go into an area that we've never worked at before, hit the ground running, be expected to take a full assignment, and just perform at the peak, and it can be really tough. That's a major stressor. So with all of that and talking about it and getting it out into the open, it's also important to talk about some ways that maybe we can combat this a little bit. So for me, it's a list of different things. I love to get outside. It's all about going out and taking hikes.
Go for a bike ride.
Get a workout in. Enjoy a nice, relaxing day by the pool. No. I had a lot of things to do today, but you know what I did instead? I took a nap. One of the best things about us as being travel nurses is that we can get out there and go explore these different areas. We get into traveling for the adventure that it affords us, and certainly utilize that as one of the stress relievers. Sometimes we have to do more than that. There is help available out there to you. Reach out to the agency, reach out to your health insurance. They have different lines and contacts for mental health and stuff like that. And if you really are looking for something and feel like you're in a crisis, feel free to call the 988 number. That is the national crisis line. It's kind of like 911, but for mental health. And it's a common misconception. You don't have to be suicidal to call them. If it's a crisis to you, it's a crisis to them. So please reach out, get help. Don't ever let yourself be caught down in something that's just too heavy of a burden. Remember, you're important, and not just because of the work that you do. Take care of yourselves. Come here, Cinder. Yeah, that's my good girl. Yeah, your belly rubs. Make sure you get those belly rubbings.
You gotta get up now. You gotta get up now.
Okay.
For real, babes.